breathing problems. In this video, we will discuss causes and signs of breathing problems as well as techniques for using an inhaler. Breathing problems can arise from underlying lung diseases such as asthma, emphysema, or pneumonia. Other medical conditions such as a heart attack, stroke, seizure, or anxiety can cause breathing problems as well. Signs of breathing problems include fast and shallow breathing, noisy breathing, inability to talk due to breathlessness, and unusual sounds. Individuals with asthma often make a musical sound when breathing, which can be heard as wheezing. High-pitched sounds during inhalation may suggest a partial blockage of the upper airway. Individuals who have asthma or chronic lung disease are generally familiar with how to use their breathing medications, such as inhalers. To help an individual use an inhaler, first, tap the inhaler canister. Then, place the opening of the inhaler into the spacer if available. Next, instruct them to fully exhale. Place the spacer or inhaler into their mouth. Simultaneously, have them inhale slowly and deeply while pressing down on the top of the inhaler canister. Instruct the individual to hold their breath for up to 10 seconds if possible. They should be prepared to repeat if respiratory problems persist. Stay with the individual until the symptoms improve or until emergency response arrives. This concludes our lesson on breathing